Hi, good afternoon, everyone. Welcome to Dr. K.K. Agarwal special episode on Tuesday. We are live on Facebook, YouTube, and all other platforms. Today is 16th of November. And over the last few years, when this COVID and the pandemic has really changed the world, we are trying to show the importance of various treatments, various therapies, various fields in our daily life. We have seen the COVID has really changed the world. Online education has become one of the major platforms. It is our always efforts to bring some social awareness for the masses. When we talk about acupuncture, we have a lot of things in our mind. A lot of people do really are getting benefited out of it. A lot of people do see this as a different therapy or a different treatment. A lot of people gets benefited and a lot of people do not know what is acupuncture. So today, yes, rightly said, this is our topic, and we would like to discuss acupuncture as a form of treatment. Dr. KK always used to follow that all medicines, all form of medicines and treatments under one roof, and what we call as also as one health. So we have with us Dr. Kabir with us. He is a specialized on acupuncture and acupressure. He is an Ayurvedic physician. He will talk about acupressure and acupuncture with us. Over to you, Dr. Kabir.
Good morning and namaskar to everybody. I'm Azam Kabir, Dr. Azam Kabir here. So I'll be talking about acupuncture and acupressure, how it is important in our day-to-day life and how it can bring changes in our lifestyle and make us healthier, apart from just having medicines and other treatments. So acupuncture and acupressure are the same thing of one form of medicines, where we use pressure on the same kind of points in acupressure, and we do acupuncture with needles and other seeds with for that is called as acupuncture.
So Kabir, can I say that acupressure is where you put pressure and acupuncture is where you puncture in the
exactly.
skin?
Yeah, we puncture in the skin with needles.
Okay, so that's the major difference, but everything is fine, same.
Everything else is the same. So
Okay.
the whole therapy of the acu therapy is very similar to what is the basis of Ayurveda. So they have a fundamental called as 5-element theory, the Pancha Mahabhuta that we have known in Ayurveda. So they also follow the same kind of root, and they come from the same kind of roots from Ayurveda as well. So it is very easy for us to correlate two therapies and two treatments at once. So coming back to acupuncture and acupressure, here the whole form of treatment is based on meridians. Meridians are points or pathways or nerve impulses or nerve roots from where body improves its health, improves its blood circulation, the sensation increases in the body. So there are around 15 meridians in our body, according to acupuncture and acupressure. Meridians have been divided into different organs. For example, you have lung meridian, you have stomach meridian, you have a spleen meridian, you have heart meridian. It is very similar. It is very easy to understand. Whichever problem the person is facing, you treat them according to those meridians. There are 12 main meridians and 3 extra meridians, which is called as the pericardium. It is called as a triple heater, a governing vessel, and a conserving vessel. So the governing vessel, the triple heater, and the conversing vessel are the 3 separate meridians, and the rest 12 are the meridians which are related to the organs. So these meridians are being placed in our body in different forms and different lines. So we use acupuncture to put needles in those meridians and then treat the cause or treat the actual problem of the disease. So how acupuncture is going to help us in treating the diseases in every day, and how are we going to know about meridians? So the basic fundamentals, which says the 5 element theory, is made up of Panchamabu, that is wood, fire, air, water, and earth. These are the 5 elements which acupuncture follows, which are similar to the Ayurvedic elements. So they use all these 5 elements, make give different elements to different meridians to treat the cause. So, for example, people have dryness, and people have lot of itchiness. So they treat that with the opposite factor to it, which is your fire or metal or earth. So it's the you treat the cause with its opposite factor. That is how acupuncture works. And coming down to why acupuncture is important at this point of time is because modern medicine and other medicines are also good enough, supportive, but acupuncture is something which can enhance their activity, which can enhance their effect on the body.
So Kabir, can you hear me?
Yeah, I can hear you, sir.
Okay. So Kabir, I understand acupuncture was something which started from China and not from India.
Yeah,
Okay,
it
so
is.
it's Chinese traditional medicine. But is there any side effect of acupuncture because you are actually piercing a external substance in your body? Obviously, I think sterilization, and you have to use the new needles. You can't use the old needles. You have to open it fresh. All those things are taken care of. But
Yeah.
has anybody seen any side effect or any infection or anything because there's something which is going in your skin, which is an external body?
So apart from the subcutaneous infection, maybe because of not using a hygienic needles, or because of other sorts of subcutaneous infection, there is not a lot of side effects being seen in acupuncture treatment. But there is one thing: when we treat diabetes, when we try to control diabetes mellitus, what happens? The person goes into a hypoglycemic condition, so his glucose level drops down to a state where we have to provide him some external sugar or any other sweeteners to increase his glycogen level. That is the only thing I have seen until now in my practice, which might be causing a side effect. But apart from that, I haven't seen any other side effects working out in acupuncture.
So this is interesting. Like when we talk about diabetes and
Yeah.
when we talk about acupuncture, when you put when you put needles on the skin, does the blood sugar immediately falls, or does it
So
like
there,
over a
there
period
are
of
there are
time?
very, so there are very sharp points, or very particular points, in which when you put the needle, we have a series of points. When you put the needles in those series of points, within around 15-20 minutes, the glucose levels just drops down immediately.
Okay.
And also the basic fundamental is to improve the blood circulation in the pancreas for diabetes, and improve the production of insulin. That is different in people who are resistant to insulin. But improving blood circulation can prevent diabetes, but to reduce the glycogen level in the body immediately, yes, acupuncture is helpful.
So acupuncture treats like what type of diabetes? Is it type 1, type 2, or it
So
can treat it like for even an advanced stage, it can treat diabetes? And what is the success ratio?
type 1 is easy to treat, not a lot of problem. But type 2 is quite difficult. It takes a lot of time. But treatment is not there for diabetes. As we know, diabetes is not a disease; it's
Yeah.
a condition.
Okay.
So we can't treat it, but we can control it
Without the insulin, you mean?
without the insulin or without the metformin medicines or whatever it is. So
Okay.
there is one case which I'm dealing right now. It's a stroke patient. It's a cerebral palsy. She's around 56 years old. It's been 1 month. She has had a stroke now, and she's undergoing a physiotherapy, and I'm doing acupuncture on her. God's grace, she's got her sensory nerves have been perfectly fine. Her sensation is back to normal, but her motor function is yet to develop. So I am hoping for the best that it comes up with a good cause, that she develops her motor function. But her sensory system is working proper. Like there is no doubt in that. And it's
So
just been 7 days. 7 days
how
I've been.
Okay. How many sittings are required for somebody like a type 1 diabetes to, or even let's not talk about type 1 diabetes, even like a lot of people we are fearing because of the lockdown, people have stopped doing a physical activity and they've seen suddenly a rise in the sugar level,
Yeah.
especially the HbA1c levels are also increasing and they are prone to diabetes. Is it something which you are advising for those people to get into at least one kind of a treatment to acupuncture, and how many sittings would they require to just try to it's basically prevention is better than a cure.
Yeah, sir. Treat the complete treatment for diabetes will have, they have to have the proper strict diet. According to that, accordingly, then they'll have to take this treatment. So, as you know, metformin as a medicine, you have to control your sugar intake to keep your glucose level down. The same way, you need to have other factors and acupuncture. For example, you can take around, if the person is following all the strict diets and he's been in the proper good regime of a diabetic patient, he can recover, he can come back to his normal glucose level within 7 sessions.
7 sessions,
Within
approximately.
7 sessions, approximately 7 sessions. It might happen faster as well, but to have a long stretch, I'm keeping it as a 7 sessions.
Okay. Is acupuncture a regular process, somebody who starts it, or is it just a one time when they find a problem and then they should only go again when there is a problem, or is that something which they should do like once in a month or something? Is that also?
So the frequency keeps reducing as longer the treatment goes. For example, initially we will start with 4 sessions back to back, and then we will tell once a week, then we'll tell once a month, and then we'll do once in 6 months, just to keep that, it's just to push the body to heal itself again and again and again and again. So sometimes people with pains of muscle pains, or sciatic pains, it's gone forever. Once it's treated with acupuncture, it's gone forever. But people with health conditions of organs and conditions which can't be reversed, they have to keep a follow-up. Like arthritis is something which can't be reversed back again. It will keep degenerating again and again. For that, you'll have to keep a follow-up once in 2 months, once in 3 months, just to push up that ability to heal the body. This is how it works.
Okay. A lot of people do acupuncture on the face. They
Yeah.
put needles on the face. What is that for?
Sir, as I said, these meridians flow in our body. So there are meridians which starts underneath your lip, goes all the way from your forehead, goes back, and then from the side of the face. So all these are meridians which flow. It is the physician's talent to choose different points in different parts of the body to give them better results. But people who do it only on the face, for beautification, for cosmetic causes, yes, these are points which are done for cosmetic causes to improve blood circulation in the skin. So as blood circulation improves, you will have lesser wrinkles, you will have lesser dark spots, your pigmentation reduces when we do acupuncture on the face. And for example, a patient suffering from sinusitis, migraine, and tinnitus, all these kind of diseases can be, or the problems can be treated with needles coming on the face. But yes, according to the size, place, and the size of the body, and the person of the body, we will have to change the size of the needles. So the size of the needle comes with 1 inch to 5 inches to 7 inches.
So is there any so let's say if there is a mistake, I don't know, like this is not something I know, but is there a mistake and the needle goes in a wrong area? So is that just a normal thing and you just pull it out and put it again? There's no harm because these needles are very, very small, or is it something which can actually create a some kind of a blood thing? So let's say it goes into the nerves or something.
Yes, this is one risky factor. That is why everyone can't do this, sir. What happens, people, when they try to perform acupuncture in the spinal region, which is the most delicate part, they try to put the needle in on top of the spine. Sometimes what happens, if they puncture a little more deep without their knowledge or by mistake, then it will puncture the nerve, which will cause a permanent damage when it comes to nerve. So we are not supposed to put the needles in the places where there are nerves. We are not supposed to put the needles where there is bigger blood vessels like your jugular vein, your carotid arteries. All these are bigger blood vessels, and smaller blood vessels will also get punctured, may cause infection. So all these are points and SOPs that you are not supposed to do.
Uh, when we talk about acupuncture, which is the best uh, like disease which acupuncture is like probably most successful? Like it can be hypertension, it could be diabetes, it could be you said tendinitis, you just said right now, or you said arthritis or something. What is the best treatment? Like what kind of patients you get more regularly?
So in my practice, I get a lot of musculoskeletal disorders, nerve compressions, lumbar spondylitis, and sciatic pains, especially related to pain-related managements, and also diseases with sinusitis and migraines. So I've been dealing with patients.
Right.
Yeah. So the thing is, these are very fast. The results are like 3 days. You'll get you're out of it. 5 days you're out of it. Maximum max to max. A lumbar spondylitis was treated around 15 days. That's it, and that person was back to normal and he could do everything. So ideal, but for a prolonged period of time, yes, diabetes is a very good has a very good treatment, and then your bowel movement has a very good treatment. Your constipation, blood pressure, but these are something that has to be followed up. But for a permanent cure, not coming back again, musculoskeletal disorders are the best.
So let's talk about headaches and migraine. You said about acupuncture. How many sittings would be required? And like you would need to put needles in the obviously on the head, I believe, right?
Yes, especially on the eyebrows for the migraine, and closer to the temple region. So I have treated, the fastest treatment was done within 3 days, sir, for a migraine because it was an acute case. But for a chronic case, around example 5 to 6 years old of a chronic case, will at least require seven sessions at least.
And is that a permanent treatment or is that a migraine can come again?
It is a permanent treatment followed with few restrictions and few do's and don'ts for a period of time, and then after that the body will develop its own strength to cure it off.
Okay, let's talk about tinnitus, what you call, or what you call vertigo also.
Yes.
Do you get patients for that?
Yes, sir. I've been treating patients for those as well. But this we consider for tinnitus and vertigo, treating the neck or the base of the neck is more important. So as the nerves, our basic nerves, which was the olfactory nerve and your the auditory nerve, all these nerves which has a base as a ganglia, the basal ganglia. So treating by improving blood circulation from the neck reduces their vertigo, reduces their tinnitus, improves their hearing, and that has also been treated well within 5 to 6 sessions, sir. Maximum 5 to 6 sessions.
Maximum 5 to 6 sessions. So that's great. Okay. So do you have anything to present, or we will do just a regular discussion?
I don't have anything to present
Okay.
on acupuncture because it's very
Okay.
technical.
So yeah. So would you like to talk about this topic some more? Like this is a very interesting topic, and the only thing we can understand is like how like it's let's say if I want to include myself in this thing, I would love to have an acupuncture. So let's say, do you have any kind of a suggestion for somebody who has never tried it and who's little scared to do it?
Definitely, sir. See, I have been facing patients with patients who do not want to get themselves punctured with needles, and they have a bad experience by doing dry needling, which is already done in physiotherapy. That's a different form of treatment. But people misconception of having a dry needling and acupuncture is different. They think the dry needling acupuncture is the same and it will hurt the same. But actually, acupuncture will not hurt. There is no cause, there is no pain when you put the needle unless and until he's a trained person. And everyone should at least give a try once. So all my patients who have treated, I just told once one free session you take. If you don't like it, then we will not continue. So the moment I put the needle, they're all comfortable. So the first session they have to experience that there will be no pain or no discomfort. And yes, sir, there's another thing where people with insomnia and depression and stress, I have been treating them. I've been treating a couple of people with that, and they've given me great results with acupuncture. Uh, because people with insomnia nowadays, usually these businessmen and politicians and other government related sectors, there are a lot of people who have anxiety issues and um, depressions and the same insomnia conditions. So treating them with acupuncture was a challenge initially to convince them, but after one session the kind of relief they found was amazing. So there was one condition where I had to put down a person to sleep within 5 minutes of time. So there are points which I had chosen to put the needle, and I put the needles and counted down to 10. I just like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and that person is snoring.
So, Kabir, my next question is acupuncture and acupressure related? Like, is that something which you guys do it together? Or
Yes,
is
sir.
that something which acupressure is not really required when you're doing an acupuncture, or acupuncture is not really required when you're doing an acupressure?
So this is what I follow here. So after doing acupuncture, there is soreness in that part, and there is that because of the needles punctured inside, there's some kind of soreness. So doing acupressure after we do the puncture is very good, with a little bit of oil or a lotion, to ease out that soreness from there, will comfort the patient to, for the next level. It will not be very difficult. But yeah, there are different things. People sometimes do not practice acupressure after doing acupuncture, but there's nothing, there's no loss. There's no loss in that. You can get an acupressure done after you're done with the acupuncture. There's nothing that you can't do it.
Okay. Acupuncture for the anxiety.
Yes,
I
sir.
believe acupuncture helps the body to release the good hormones and reduces the stress hormones.
Yes.
And on a long-term basis, it really relaxes. I think acupuncture, if you combine with a meditation, it can really show wonders in the body. It can relax your mind. It can produce good hormones. Anything you want to say on this?
Yes, sir. I want to share a few points, basic points for anxiety and depression and insomnia. So because these are the same points. So these are points which are present in your eyebrows. From the starting of your eyebrow till the end of your eyebrow is where there are points you can release. So for example, if you have a bad headache, you will just feel like releasing this points. You're pulling the eyebrows out. Compression, pressing all over the eyebrows, rubbing against the hair follicles. So there are points which start from the base of your eyebrows. So if you can put pressure at the base of your eyebrows, you will find a pit. You'll find a small pit-like projection there. So you will start from there. You will rub against the eyebrows like this, and you push it against your temple and hold it here. You do this around 5 to 6 times continuously. Close your eyes, or you do it to yourself, or ask someone else to do it. You will fall asleep immediately. This is one simple kind of a treatment that I follow on myself when I am alone and someone else is not there to do it for me. That you get that blood circulation proper enough in your brain to think during examination or during stress. It really affects a lot. So there's one good point you can take from the eyebrows to massage your eyebrows.
अभी ये ना आपने एकदम से जब बात कर रहे थे तो I just figure out whenever I'm stressed and I'm having a migraine, or let's say if I'm just having a normal headache, I don't really know how to differentiate between a migraine or a headache. It's just that people say okay. So I just go and take a head massage from a salon, and then I just specifically ask them to, bhaiya ye wala press karo point, and that just reminds me that how close we are for daily life for doing what we are doing, what you're saying, and it
Yes.
really reduces, like वो एक ना feeling आती है, okay fine, this is the world we are want to see, and this just take a breather and relax, forget everything. And he's just moving around the
The
hands.
buzzing in the brain is
Absolutely. So how is that related?
uh, these points, which it starts from the eyebrows, improve so much blood circulation in your brain. So much of oxygen is supplied in your brain that your brain has to cool down for a while. These points are very fast. These points affect immediately. The only thing is improve blood circulation and breathe. So we breathe. So they say in yoga we have to start breathing if we feel anxiety, or if you're feeling stressed. So breathing is what? Breathing improves blood circulation. This also improves blood circulation. So it's the same. And also there is another small thing I want to share with people, that people who go get massages done, go get complete body massages done to relax themselves. Instead of getting a complete body massage, just ask for them to get a palm or a foot massage, a hand or a foot massage done, especially this part of your hand and this part of your hand. Yes, exactly. These parts, the lower part, the
Yeah.
dorsal. Yes.
Yeah.
So ask the masseur to give a good massage in your palms and sole. You will not require any other massage in your body. That's because this treatment is called as shujok. There are different kinds of treatments in acupuncture itself, sir. See, there's something called as scalp acupuncture. There is something called as your needle acupuncture. There's something called as electroacupuncture. So these are forms of acupuncture. So electroacupuncture is where we use a needle stimulator or a stimulation machine which provides mild electric pulse that pass through the punctured needle inside the body. So people might think this is a little bizarre, but this is very effective when it comes to musculoskeletal disorders. So for example, there is a rhomboid catch or a neck catch. Put few needles and they give electric impulses to that, and that person is ready to go for the next. Nothing he has to do. He doesn't have to take a pill. He doesn't have to take rest. He can go back to his work normally. So electroacupuncture, scalp acupuncture, and normal acupuncture is all done. Coming back.
Okay. I'll let you continue.
Coming back to shujok, what I was talking about, a small Korean form of a treatment. This is also based on acupuncture only. So they say the whole body can be reflected on your palms and your sole. Your palms and sole have all the points which are enough to supply blood circulation in your body and improve your health. So they say your four fingers are your four appendages, like your hands and your legs. Your mobile parts are present in your four fingers. So they say the middle two fingers are considered as your legs, and the index finger and the little finger are considered as your hands. So we have three joints in our finger, that is 1, 2, and 3 joints. So these 3 joints reflect 3 joints in your legs, that is hip joint, the first knuckle, the knee joint, and the elbow joint. 3 joints here, 3 joints.
So this is one joint.
One joint. This is your elbow joint.
And this is the third joint.
Knee joint, and this is the hip joint.
Okay.
The same goes with your hands. This will be your shoulder joint. This will be your elbow joint, and this will be your wrist joint.
Wrist joint.
So they resemble the same.
Okay.
And then if we think these are our 2 legs, so and this part of the hand is considered to be the posterior side of the body, and this part of the hand is considered to be the anterior side of the body. So if this is your posterior side of the body, these are your 2 hip bones. In between your hip bones is your spinal cord. So this part in between resembles the spinal cord. In olden days, they didn't have X-ray machines or MRI scans to see where the problem is or where the injury is. So this is how they used their knowledge and their technology to find out problems in the body. So I do the same thing. I don't ask people to go get an MRI. I don't ask people to go get an X-ray unless and until it's a fracture or a very serious issue. So you can easily diagnose things in this. The person who's having a lumbar pain or a sciatic compression, you just need to press. Imagine these are your 2 hip bones, and your sacral and your lumbar spine will be here, right above the hip bone, which is the end point of your vertebral column. Just try to put pressure on this part for people who have lumbar pain, like good amount of pressure. You will feel that pain. Try to do the same thing on the shoulder part, the next part. You will not feel that pain.
Feel the pain here, you will feel the pain in the shoulder.
You will feel the pain here in this part.
But isn't that something obvious? Because if you're putting a pressure on a point which is obviously between the knuckles, you will everybody will feel the pain.
Yeah. So what you need to do is check. Try to put the pressure point in the next knuckle.
Okay.
You will not feel the exact pain what you're feeling in this knuckle.
So is that what I understand is wherever you feel more pressure? Sorry, my battery is getting over. So just give me a second. Yeah. So is it true that, so let's say if I feel more, like I feel less pain here, so this probably is my is something which is not a problem in my body. But if I feel more pain here, or if I feel more pain here, that means there is some kind of a problem in my shoulder or something.
There is some discomfort in that part of the body. So you need to ask. For example, when I press a person's hand here and ask him, okay, do you have a history of a lumbar pain, or do you have a history of a sciatic pain? Obviously, people have told me yes, because it easily correlates. And then people who are suffering from neck injuries or cervical spondylitis, I try to find out the point where in the exact knuckle and press there, and it hurts, and it hurts very bad. Like they literally have to take the hands back again.
Okay.
So this is how is called as shujok, or something called as reflexology. Reflexology and shujok are something very similar.
This is interesting.
And coming back to this part, the other side of the hand, this is considered as the anterior part of the body. Here lies all your organs. So all your organs are being located in different parts, reflect on different parts of your palm. So finding out those organs and those points, and then pressing them, and then checking out if there is pain. See, there are two kinds of pain. One is because of an injury, or one is because of the discomfort or a problem inside the body. So we'll have to identify what actually is the problem. Either you'll ask him, okay, did you have a fall, or do you ride your bike, or do you do some kind of strenuous workout with your hands? And if so, yes, then we'll have to rule that out. Okay, we can't do the diagnosis from this part. If the person says, yes, he has cold, he has sneezing, and he has lung congestion. So there are points in your palm where you press and the person can't tolerate the pain. And that point, using that point to heal your lungs or your running nose will work.
Okay.
And it is very immediate, and you will see immediate release. Like there is one point which is called as the liver point in your palm. People who have running nose, like for example, if you join your thumb and your fingers, you'll feel the edge of this point. So if a person puts a needle in this point, or a pressure in this point, who is suffering from running nose, his running nose will stop immediately. He will not sneeze again.
Okay, so Kabir, I just pulled out one image from the internet. It's a random image. Just while you were talking, is that something true, or is that something just a wrong image? Is that right image?
Yes, sir. This is right.
Okay, so probably every organ of your body is in your hand. Is that what it is?
Yes, true.
Okay. So you want to explain this image? Like, I know you already did it, but do you want to explain with the image?
Sir, as I said here, this is our left palm and the right palm. So they have said this place, example for the liver, where it says the yellow marking in the edge, which says there's a liver here. The person who's having a liver cirrhosis, or is a chronic person who drinks a lot. So if you have to diagnose that his liver is working well, or there is enough blood circulation there, you will just have to put pressure in those points and check if it hurts a lot.
Okay.
If it does, then there is something going wrong in his liver. There's some problem happening in the liver. You can't find out what exactly is happening, but yes, there is something happening in the liver, and you can rectify it by putting acupressure every day in that point, like 30 times a day. You do that continuously, then one fine day you go get a blood test done. You will get it normal. You'll find the report to be normal again.
And both the hands are mirror, or they are not?
Both the hands are the mirror. Both the hands, left and right, both the sides. There's nothing to do on only on one hand.
Okay.
And I just said the sciatic lower back, and people who have what is it called, the menstrual pain, or the cramps, the abdominal cramps. So there are points points in this hand where it says ovarian Yeah, it says there's something called as an ovarian point here. Yes, yes. So people with abdominal cramps and people who are suffering from PCODs, they have to use these points to put pressure. These are just normal pressure, like how you do a massage. Exact kind of a pressure you will have to do a couple of times, like 15 times, 20 times a day, regularly for a long period of time, and then definitely it will subside.
So Kabir, you can figure out that there is a problem in these organs, or you can also do a treatment with these
We can
points.
do a treatment and figure out. So
Okay.
once we figure it out, we have to use the same points and the same place to put pressure. So this is here comes acupressure. But to be frank, that acupressure is a little slow when compared to acupuncture, because it's just a pressure. It takes longer time. But if you're doing acupuncture in this point, the results are more faster.
So technically, this area does not represent any of the body organs. Where is the
No,
there
sir.
is a complete blue.
Yeah, this part can be considered as your small intestine and large intestine. So for example, people with bowel movements. So people with bowel movements, this it comes like a transverse colon. So if I invert my hand down, if this is your legs, these are your two legs, this will be the anus or the exit point for your food. So this will be your colon, the complete part from here. So you have to massage completely from here to here. Like you do this, you rub around the colon, like you're moving the stool out of your body, rubbing around the colon like this and pushing out will improve your gut health and will improve your constipation issues. And coming down to the ends of these fingers have large number of nerve endings. So that is why they say when you press these parts, it's your head and brain. It's considered to be as the head point and the brain points. Yes, these part here, this part here. Yeah. So people, when you keep pressing down to this part, improves your intelligence. They say it does, but actually it does improve. It's not just a myth. It is scientifically proven that yes, doing this point, putting pressure on your fingertips, improves your circulation to the brain, which definitely improves your intellectual capacity. And then here we have arms. They say diaphragm, adrenal, liver, this gallbladder, there is kidney, there is hip joints. Yeah. So
Do we also have a treatment for people who have sensitive stomach or have a gas problem?
yes, sir, but not in the hand. I would suggest the hand for the gas problem is not that effective. In my practice, I didn't find it to be that effective. But releasing your releasing your rhomboid muscle, which is at the back, which is a muscle right below your neck, can improve your gastric problems to a very advanced level. You will start burping out when you start releasing your trapezoid muscle and your rhomboid muscle. Yes, there are points here in your hand as well. The stomach point, releasing the stomach point and the liver point. See, your gastric problem happens with your gallbladder and your liver secreting a lot of bile juice inside your duodenum, and then the gastric acids, and then it fills up with the stomach with air. So treating liver and stomach will improve your gastric conditions. And putting pressure, you have to put pressure on these parts. Like there is this part which says stomach. In this part, you need to put pressure on those points as well to increase your digestion. And there is also something, there is also called as an organ clock in acupuncture. They say early in the morning, like for around 4:30 to around 3:30 to 4:30 in the morning, is the time for your breathing capacity. Your lung is the most activest part at that time. So they say that is how you can correlate Ayurveda. They say wake up early in the morning, Brahma Muhurta, sit and read, and you can meditate in the morning, because that is a time where your lungs are at its maximum capacity. You can cure your lung issues and lung disorders at that time of the day, like morning 3 to 4 o'clock. And then after that, you have your stomach time, which stays around 7 o'clock to 8 o'clock. 7 o'clock is a time where your intestines are active. That is why most of the people will see कि 7 बजे उनको pressure बन जाता है, उनका pressure बन जाता है 7 बजे. They have to run to the washroom at 7ish, 8 o'clock. That is why at 7 o'clock is a intestine time. And then coming down next after the intestine, it goes to the stomach. Stomach around 9 to 10 के range के बीच में आपको भूख लग जाएगी. You will start feeling hunger. That is where your stomach is in its complete movement. मतलब उसका पूरा gastric juice निकलेगा. Your vagus nerve is completely active at that time. So there are organ clocks. According to the organ clocks, the treatment will change.
Yeah. So just something came in my mind. A lot of people say if you have a couple of glass of water in the morning when you wake up.
Yeah.
You want to cover anything on the screen, or I'll close it first?
Yeah, you can close the screen, sir.
Okay. So a lot of people do say, you talked about in the morning, people have early morning, they have motions when they wake up. There's a process of the body which is there. A lot of people say they drink water in the morning, early morning. They have a 2 glass of water. It is very good for health, especially when you drink it without the brush. Yes. Is that something which has come from the Ayurvedic science or acupuncture or something, or is that because when you drink 2 glasses of water when you just wake up, it puts pressure in your intestine or something? Yes. Is that an internal something which is happening?
So here you can take it in the form of, you can take it in 2 forms. One will be where you're detoxing your body, you're cleansing you're cleaning your renal system, you're cleansing your digestive tract, and you're putting pressure to release out the content from the stomach. So ऐसा हो रहा है कि रात भर जो भी grind हुआ है, it will just wash out at once, and your stomach and your intestines are fresh for the new intake. So why they say to take warm water? They say warm water पीना is अच्छा है. ठंडे पानी से गर्म पानी पीना अच्छा है, because your temperature, your core temperature is warmer than the water you're drinking. So you are not supposed to disturb the temperature. What happens the moment you put cold water in your stomach? Most of the contraction happens. So you will have abdominal cramps early in the morning. You will have muscle contraction, because cold is not what muscles are used to. They are used to warm temperatures and warm blood. So the moment you put warm water into the body, it cleanses off. It cleanses off your whole stomach, your intestine, your renal tract, and everything is fresh for the new start. That is all the whole science is all about for drinking water.
So, and what is the concept of having it without the brush?
Sir, I don't think so. There is any scientific thing proven to have without a brush.
Because somebody likes we do hear that if you drink the warm. So again, just for our viewers, warm water does not mean boiling water. Warm water means
warm water is just lukewarm water.
Just lukewarm water, because I came to know from somebody that if you drink a lot of warm water, a lot of hot water, it cleans up your intestine. It cleans up, because the cholesterol which is stuck, it gets melted out, and like, this is not something you should do, because it will all burn out inside.
Yes.
Yeah, you can still have tea, but you should not have tea to the extent that it really hits your body inside.
Yeah, people again have a habit of having empty stomach morning coffees and morning teas. But to a kind information that drinking tea early in the morning is the most wrong thing people are doing. You are supposed to eat something, first cleanse your stomach, and then put whatever you want, because tea will increase bile production in the body and lead to gastric issues.
Absolutely.
So drinking tea early in the morning is wrong. No, there's nothing worse than that.
Having a habit of having tea, if they want to leave, what is I suggest that they should start having warm water.
So there's something called for withdrawal of the tea. The withdrawal symptoms what people get from the tea, they have to change that to Zira tea. The Zira chai, boiling Zira in water and drinking that. See, that will keep that urge down. That will keep that withdrawal symptoms of chai down and coffee down, and improve your health. Gastric भी कम करेगा Zira, and will help you withdraw from.
What about adrak and kachi lychee or kachi haldi?
Adrak is very pungent, sir. Adrak is very pungent, and taking it in empty stomach is good, but people who are old, no, people who get into their geriatric stage, for them giving adrak and elaichi empty stomach is too much. It's too much heat in their body. That will upset the stomach and they'll have loose motions and diarrhea. So Zira is something which will cool down the system rather than making it hot.
What about having warm water with honey, which it's not required, right?
Warm water with honey is not actually required, but people have this belief that it will lose weight. Yes, Ayurveda also tells that honey is not something which is going to increase your weight, or it's going to toxify your body, but it has the capacity to detox. Taking that in lukewarm water is very ideal, but if you take honey in hot water, it is disaster.
So, Kabir, I look, there are a lot of advertisements which comes of honey, which says, have honey in the morning, it will help you to reduce weight. I just want to highlight to my audience saying that people who are diabetes, especially like who has type 1, type 2 diabetes, honey is not good for them also. It is a myth which says that if you have honey, it will not cause your diabetes problem. Honey is better.
No.
Is better for all other sugars, refined sugars, if you take it. But if you're not having a sugar and you just add a honey because you think that it is good for diabetes, it is a myth. It is wrong.
Everything has fructose. Everything has a source of glucose or a broken down form of glucose. So honey is honey. Honey is sweet. Anything that is going to taste as sweet will have glucose, because your tongue can't lie.
Absolutely.
And coming down to, there are acupuncture is not complete with kind of herbs which are present in China, sir. So here, because we have Ayurveda, we can incorporate Ayurvedic herbs and drugs and then give them together with acupuncture treatment. See, acupuncture treatment also believes in herbal medicines and herbal form of medicines and all those stuff. So those medicines are not available here. So what we are trying to do is incorporate Ayurvedic herbs and medicines into the acupuncture form and then give it to the patients. So they have Chinese have different kinds of teas. You would have seen in some movie ke usne chai pilai aur wo theek ho gaya. So these teas are made from different herbs. These herbs are very powerful when compared to, like for example, ginseng. They say ginseng is a very powerful medicine when it comes to immune boost, to boost the immune system. So ginseng is basically good from Korea. The best form of ginseng you can get is the red ginseng from Korea. So these medicines are not potent enough, which they are found in India. Some medicines are good at Korea, some medicines are good in India. So whatever is available in India, we use that to treat people.
What else? Anything we are almost like 5 minutes away from the session. We would like to wrap up the session in the next 5 minutes. So it's an interesting and it's a long conversation, which we are getting into it, and we'll cover up more sessions. We already have 4 sessions with you. We'll cover one session at least a month from your side on these Ayurvedic acupuncture topics, or for that matter, any science related to different form of medicine. And so we all want to stay fit. We all want to. So any lifestyle changes you want apart from the regular acupuncture or acupressure techniques you suggest? Like any tips which you want to give it?
Sir, people with cold and cough. I can give you this point. The point which is present in right between your the thumb. When you close your thumb, the point which you can see in this part is a very good point for your cold and your running nose. You can just press here from this side like this. Keep pressing there for around 25, 30 times a day if you're suffering from running nose. Yes, this point exactly here. So when you join your thumb and your finger, the edge which you see is the point.
Both hands?
Yeah, both the hands. You can do 25 times in this hand and 25 times in this hand. that will improve your nasal passage. It clears your nasal passage, reduces your headache. And also a point, for example, this, when you join your, when you close the elbow, the point which ends here,
Okay.
people who have neck pain, people who are suffering from spondylitis, or people who have sleeping problems, or even people who are suffering from cold. This is a point that they can press. So when you do this, you will have, this is how you do it. So you find the point and you open your hand and you press like this.
That's interesting.
So this point, if the person is having a neck issue or a cervical spondylitis, these 2 points, this point and a point which is present in your elbows, he can massage there or put pressure on those points. He will get good relief. Like it's like a first aid box of points where you can use it when you are in an emergency situation, or you have no one else apart from you in the place. And as I said, these eyebrows are very good. And people who suffer from sinusitis, for them also, their important point is the point which is present at the starting of their eyebrows, right in between here. So you'll find a pit. Try to put pressure in those points. So when you press there, you'll find a pit there. Do you find a pit there?
Yeah, yeah.
Yeah. So that pit has to be given massage like this.
So how
Yeah.
much pressure do we need to put? Oh my
As
God.
much as, only as much as it doesn't hurt, until it doesn't hurt.
Okay, you should have told me before. I just hurt myself.
And then the next point is, which is right next to your nostrils, like next to your nostrils, like you'll have to keep it like this, in this way. The point which is present there, that will be very sore for people who have been suffering from sinusitis. For example, the maxillary sinus and the frontal sinus, whose pockets, whose frontal sinus and maxillary sinus are filled up. They can release these points. They can put pressure in this point and just do massage like this. How release it? They'll feel a lot of difference. Doing this regularly, you will see your sinuses draining out. You don't have to get it operated, drain out the sinus and then come down. Within few days, if you're doing it regularly, you will feel that sinuses draining out of your nose itself.
If you have a problem of cold, you don't take medicine. You must be doing yourself. Start doing it.
Sir, it has almost been a year I've taken a paracetamol or a painkiller or any sorts of drug after since COVID. Either I take acupuncture or I take Ayurvedic medicines to just treat myself and my family as well. I make sure everyone, I push them to a limit. They only have to take Ayurveda, and if it doesn't work out in that, then I'll tell, okay, fine, paracetamol kha lo. But nothing more than that.
So we need to live that lifestyle as well, and it's nice to be away from the like it's nice to be with the nature as possible.
Correct.
And I also believe you are a fitness person. You are a fitness expert also.
Yes, sir, I am.
So okay. So we talked about this point. We talked about this point, and
This
then we
point.
talked about this point, and we talked about this point.
Yes.
So this is for migraine. This is for sinusitis. This is for
neck and back issues,
neck and back.
Issues.
And this is for
cold and cough.
Cold and cough. Okay.
And for people, for just categorizing it to people who can get it massage or something, people who are suffering from their shoulder immobility and people who have neck catches, or often जिनका गर्दन मुड़ जाता है या फिर मोच आ जाती है, don't get your neck massaged. Rather than that, get your upper back massaged. So upper back in the sense anything which is below your neck and above your lower back. Get your upper back massaged. Your neck is already sorted. The pressure, so the pressure builds up from your rhomboid muscle and your trapezoid muscle and your rear delt. 3 muscles: rhomboid, trapezoid, and rear delt. These are 3 muscles which has to be released and massaged gently, which will release your compression or whatever kind of sprain you have in the neck. You will find a lot of difference. And people have this habit of going to salons, cracking necks and all that. Yeah, I have had more than 100 people who have gone to them and sprained their neck, come back, and it really is a very wrong practice people shouldn't do. chiropractors do it, but they do it professionally because they're trained for it with a different angle and position. But you want to try it by yourself, you'll have it sprained.
Okay.
Yes.
And what about people pressing the knuckles? Like, they're doing.
Knuckles are still fine, sir. It's just nitric oxide coming out of their knuckles, and then that's not a bad thing. But people say it is not good to do that.
Yeah.
But there's nothing scientifically very bad about it.
So thank you, Kabir. It was a wonderful session, very exciting. It was always a very nice talking to you. You have been a very good coach for us. And we will have further more sessions. Thank you for joining us. Thank you, audience, for watching with us. Be here. We will come up with a lot of other topics, exciting topics. If you have questions, do write the questions. We did not got a chance to take questions in this session, but we will definitely cover those questions in the next session. It always helps us to know what is going around in your mind. With this note, we would like to close the session. Thank you once again for our speaker to join this. See you again next week, same time, same day. We have coming up more sessions. Do join us of all the sessions which are going on